A CDC study shows that the rate of self-reported postpartum depression symptoms among Black women was 60% higher than for white women. Alicia Lee with March of Dimes Houston joins me to talk about this data. So, Alicia, a very disturbing study from the CDC indicating that self-reported postpartum depressive symptoms among Black women was 60% higher than for white women. Why are we seeing that?
Yeah, so thanks so much for having me tonight. It is a pleasure to be here with you. And, what we are seeing is we know, according to our data, that about 1 in 5 women postpartum, so after delivery, are experiencing some sort of mood disorder, be it postpartum anxiety, postpartum depression, thoughts of potential suicide. But what we know is that is underreported because of the stigma associated with maternal mental health and seeking help. But then also what we know is that for our women of color, for our Black women, that is most likely it is higher. We are seeing higher rates for them because of the associated places and the social factors that are really ultimately affecting the health outcomes we're seeing for our moms and for our babies. And we know that things such as socioeconomic status, the education that you receive, all of those can play into the role. And we know that our women of color, our Black women, unfortunately, they are starting out not having access to some of those things because of the historic and the systemic racism that has been occurring in our country.
And of course, we know going down the wrong path with postpartum depression, it could end up deadly, but for both the mother and the children. We've seen cases here in the Houston area where it ended badly. For those who may be having problems, postpartum issues, what would you suggest they do? Obviously, you guys have an alternative like doulas that can get involved. First of all, for those who are not familiar with a doula, tell us what that is and how it can help the process.
Yeah, so in Houston, we are working with community-based doulas to establish a doula training program, or we have established a doula training program, a comprehensive program. And a doula is a trained professional. She or he is a support person for the birthing individual and for their partner. They provide education, they provide supportive measures, they assist in the advocacy to allow the birthing individual to know kind of what's going to happen in birth and in labor and delivery, and then also to do home visits in that postpartum period, to have that another touch point for that individual to be able to see someone. They are, again, not a clinician. They're working in partnership with and saying, if you're feeling a certain way, this might be normal, or maybe we need you to call your healthcare professional. Mm-hmm. Maybe we need you to call the National Maternal Mental Health Hotline, 24 hours, 7 days a week, 1-833-TLC-MAMA, M-A-M-A. This is a hotline that's available to anyone.
A lot of people don't know about that hotline, Alicia. This is my first time hearing about it.
Yes, it's 1 year old. It celebrated its birthday last month. And really, so 1-833-TLC-MAMA, and it is available in multiple language. It is staffed by professionals, and then they can help you either with whatever you may need to talk with someone about at the time, or potentially direct you to some other resources that are local in your area.
Now, when you guys get the doulas trained and ready to go, what period of time are they there, from the process of just before birth, well before birth, or as you're giving birth and after?
Sure, great question. So our doulas, many of them do prenatal visits. They are home visiting, so they will come to you. As a result of the pandemic, many doulas have virtual consultation as well. So they'll meet with you anywhere from 1 to 2 to 3 times prenatally, and many of them say, book a doula as soon as possible, because then that will allow you more time to have access and availability to the doula for your questions and support. The doula will then be with you during labor and delivery. Just as you are going into labor, you go to the hospital. One of those things that you also do when you're going into labor, you call your doula. She can also help you determine, is it the right time to go to the hospital right now? Or maybe, if your water just broke, maybe we don't need to go to the hospital right now. But again, she can help provide advice from what she has seen, because she has many clients. And then after delivery, doulas will, they'll do 1 or 2 or as many postpartum visits as you see fit with the schedule that you have made for your doula. And really during that postpartum time, that doula will help you with things such as breastfeeding and lactation and pumping, and how do I get a good latch. Other things such as healing measures and comfort measures. And some of them say they will draw you an herbal bath and have birthing person, have mom go to the bath. You have time for yourself, because we know that is also important. Self-care is important. But then the doula will watch the baby while mom gets that time for herself. They offer a wide array of the services that they offer postpartum.
That sounds like your best friend and your mom rolled into one.
Exactly. And you can call them and they can show up. But they're also, they know when to leave.
And of course, we're not done with this very important conversation about Black women and doulas. We'll continue it after the break. Welcome back to The Factor Uncensored. It's no question if a doula can help women out during and after their pregnancy, but how much does that typically cost? Alicia Lee with March of Dimes Houston joins me to answer that very question. We know many people of color don't get the mental health they need because of the cost associated with it or the lack of insurance. When we talk about these doulas, how expensive is that?
Yeah, so a doula package can range. A doula is a small business professional, typically a one-person employee. And so she sets up her services and her package of what that looks like. Anywhere, if you have a virtual doula, anywhere from probably around $600 on upwards for, depending on how many visits, depending on the number of other additions, such as birth photography or additional postpartum visits, potentially, cooking a meal or the like, anywhere upwards of $2,000, $2,300. Mm-hmm. Really, it's a negotiation that you will have with the individual that becomes your doula.
Not bad to have a best friend. You can buy a best friend during your pregnancy for $2,300. For those who would like more information, Alicia, where should they go to get that?
Sure. So we would love for you to visit the March of Dimes website. It is ignitingimpacttogether.marchofdimes.org, and you can find out more about the Houston work that we're doing.
All right. Alicia Lee with the March of Dimes here in Houston. We appreciate your time and thank you for joining us here on The Factor Uncensored tonight with this valuable information. I'm sure that's going to help a lot of women out there. I mean, many of them feel like they're alone during that pregnancy, even though they have their significant other there. But to have someone paying close attention to them, this will make a difference. Thank you, Alicia, for joining us.